Hello, ma'am. Welcome back to Pregamate. So, for this time, we have a topic which is very important among females, which is breast cancer, and we'll take some questions related to it. So, let's just first get started with what is breast cancer and how it is diagnosed.
Right. Hi again, Purvi, and it's great to be back. Now, like you very rightly said, one of the most important topics for all women, I want to say, starting from teenage, all girls should be aware of what breast changes are and how we can self-monitor and look for any kind of early changes to this deadly disease, which is breast cancer. When it comes to a definitive diagnosis, so that is for sure finding out whether a person has breast cancer or not, the only way is to do a biopsy, which in simple terms means taking a sample, right? However, there are other ways in which we can predict, like mammograms, which are low-dose X-rays of the breasts. There are ultrasounds of the breasts. And yes, last but not the least, self-breast examinations. So this is, in a short summary, how breast cancer can be diagnosed.
Next question we have is how does it affect the body?
Right. So like all cancers, even the cancer of the breast can spread through the body, or what we call in medical terms, metastasize. It can travel through the bloodstream to other parts of the body. It can lead to deposits in your brain, bones, liver, lungs, and elsewhere. Complications could include blockage of the blood vessels, fractures of the bones, pressure on the spinal cord, and so on. Now, none of this information is to scare you. It is just to drive the message through that it is really important to try and practice preventive measures.
Definitely, ma'am. So I would like to ask, is breast cancer preventable, or how can one lower the risk of having a breast cancer?
Excellent question, Purvi. Extremely important to keep up a healthy body weight, exercise regularly, avoiding or limiting alcoholic drinks, and for women who are on oral contraceptives, that is birth control pills, or on hormone replacement therapy, make sure you regularly consult your gynecologist or doctor to find out whether the medication that you're taking is the right fit for you and what the risks involved are. If possible, breastfeed your children. It has been proven to reduce the risk of breast cancer. And lastly, if a person has a family history of breast cancer, especially in their immediate relatives, for example, mother, aunt, or sister, you could be carrying a gene in the family. And to be precise, these are called the BRCA1 and the BRCA2 genes. Nothing to panic or worry, but talk to your doctor about different ways in which the testing can be done and the ways to then further lower your risks.
Okay, so ma'am, as you mentioned about BRCA genes, so when should one be tested about it? Like every female should get tested about it, or just a particular group of females?
So Purvi, testing every female would, as per research, not make sense, because actually your risk in the general population of carrying the gene is very low. Like I mentioned, if there is any history of breast cancer in your family, please go and speak to your gynecologist, and they can then assess and decide whether testing would be recommended for you or not. It's really important to avoid self-diagnosis and self-testing. Important to take the right advice from the right persons, and unfortunately we cannot generalize whether BRCA gene testing should be done for all or not. It's very case-based, so it would be important, if, like I mentioned, there is a family history, to speak to your doctor.
Definitely, ma'am. And what is usually the first few signs of having a breast cancer?
Okay, so breast cancer a lot of the times may not have any signs, but one of the most common symptoms or which a patient would herself feel is a lump in the breast, right? So let's talk about self-breast examination here. We will be sharing some clips with you on as to how it should be done, because sometimes looking at pictures helps, but start by looking at the difference between your breasts. So hands by the side and hands on your hips, pulling your elbows forward. Look at yourself in the mirror. Then use 3 fingers when examining your breasts, right? Examine the areas surrounding the breast, especially the underarm area and the area just below your collarbone. Perform the test at the same time each month, preferably after your period. This summarizes how you can yourself find out whether there are any changes, and if you do notice a change, anything that is abnormal for you, make sure you go and report it to your doctor.
Definitely, ma'am. And how does, I'm just very curious, I would like to ask, how long does breast cancer take to move from one stage to another?
Well, Purvi, that depends on the type of cancer and the kind of cancer, right? So, yes, depending on the slower moving cancers, they take to a lot of years, right? However, there are some faster cancers, okay? So, it's a very variable answer, right?
And last question I would like to ask is, how can breast cancer be treated?
Wow. Well, that is something which requires a holistic approach. You need to have a specialist breast cancer surgeon, your oncologist, and yes, of course, your own gynecologist involved, right? Treatment would include surgery for a lot of the cases, chemotherapy, that is taking certain medications, and radiotherapy, that is radiation. Right? Now, it varies depending on the stage and the type and the kind of cancer. So it would be very individual based. But let me reassure all our listeners that science has made great advances, and a lot of women are being diagnosed with early stage cancer, getting good treatment and having a good quality of life after.
Well, that is something positive to end this on. Thank you so much, ma'am, for sharing such great insights on breast cancer, and I hope this would be helpful for each one of us. Thank you.
Thank you, Purvi.